Doctors thought baby Joy had a small tumor in her stomach, but when they investigated further, they discovered something terrible. Before we start, smash the like button and make sure to subscribe if you haven't, and hit that notification bell so that you won't miss any new stories. The car swayed violently from side to side as Michael sped through traffic. In the back seat, his wife Suzanne screamed in agony. She was going into premature labor and sensed that something was wrong. They had to reach the hospital as fast as possible. When Michael brought her to the emergency room, he attempted to relay all the necessary information about Suzanne. She could barely communicate. Pain of childbirth was excruciating. The doctors took one glance at her and understood they needed to rush her to the operating room immediately. Her blood pressure was dangerously high, and the baby began to exhibit signs of distress. As Dr. Matthews scrubbed his hands alongside his colleagues, he couldn't help but comment on the situation regarding the C-section. In her medical file, the obstetrician-gynecologist noted that the child was not healthy. The doctors suspected she had an underdeveloped liver, which resulted in a severe tumor. Concerned about whether they could extract the baby in time, the doctors worked at a frantic pace. They successfully performed a spinal block, allowing Suzanne to remain conscious, though she was anxious about the potential loss of her child. With each passing moment, her condition worsened, and then suddenly, a weak scream pierced the air. Despite its fragility, it was unmistakable. She desperately tried to catch the doctor's attention. She wanted to see her child, but everyone ignored her. Suzanne saw nurses approaching her, and then suddenly everything went pitch black. Michael was beside himself. He just saw his wife go completely limp. He screamed for someone to help her. He was sure that she had just died. Doctors feverishly began to stitch the wound. There was blood everywhere. She started bleeding. While the doctors worked hard to get her back to normal, the nurses tended to her, trying to revive her. Everything swam before Michael's eyes. He didn't know what to do. That's when the nurse directed him to his little girl and asked him to focus on her. He was completely stunned when he first saw her. He could hardly believe it. She was here and she looked so good. Her tiny pink body looked as strong and healthy as it could at that age. He was so captivated by her beauty that he almost forgot about his wife. When he turned his attention back to her, he felt sick. Doctors were now using electric shocks on her to try to get her heart pumping again. Michael simply leaned over his baby and began to pray as hard as he could. He asked God to keep his wife healthy and unharmed. This is not how things should have happened at all. Suzanne was so happy and excited to find out she was pregnant. It was completely wrong for it to end like this. Just as he was about to pray again, he suddenly heard the nurses become agitated. Suzanne returned and slowly regained consciousness. It was a miracle. He immediately asked the nurses to take his daughter to show his wife. He wasn't sure how long she would be with him and wanted to make sure she got to know her. Suzanne saw the little angel who had been living in her tummy for the past 8 months. She was so grateful to be alive. After that, the nurses had to take the child away, saying that some tests needed to be done. Hearts. Suzanne and Michael were filled with fear. They knew the baby was premature. But how could this affect her condition? Will she be okay? Suzanne's blood pressure rose sharply, which became extremely dangerous for her, so she had to be given a sedative. Poor Michael was left practically alone, having to face the fact that there was something wrong with his daughter. He was confused, not knowing what to do. But the hospital made the decision for him. They simply told him that he should sit in the waiting room and just wait. They couldn't let him wander around the hospital, anxious and indecisive. Of course, this made him even more angry. He needed to know what happened to his daughter. While Suzanne was slowly being brought out of her tranquilizer state, they tried to calm her down as best they could. Naturally, she was in despair and wanted to know what would happen to her daughter. Michael told her everything he knew and then was forced to sit and wait. So, can you imagine when the doctor first entered the room? They almost attacked him. They were determined to find out what was going on. The doctor's expression spoke for itself. This was bad news. When he spoke, a gust of icy wind seemed to burst through the door. "There's something wrong with her, but we're not quite sure what it is. She refuses to eat and her stomach is very bloated. We need to investigate further before it is too late," the doctor said. The young parents could hardly think soberly. This was truly a worst-case scenario. If they can't find out what happened to their daughter, they may leave the hospital without her. Just thinking about it made Suzanne shudder and cry uncontrollably, but then she remembered about the tumor in her liver. She quickly began explaining to the doctor everything about the suspected tumor that the radiologist had discovered on the last scan. They mentioned something about a small tumor in the liver that was really bothering them. Suzanne was convinced that this was the cause of her daughter's problems and insisted that they investigate further. It immediately became clear that the doctor admitted this possibility. He looked as if this theory made absolute sense to him. He told his parents that he would look into it and immediately left the room. Doctors allowed Michael to accompany his daughter to all further examinations. "We started," as Suzanne said, "with the stomach. They examined it thoroughly to identify the problem." Of course, there, as in everything else, there was a noticeable education. It seemed like it was not attached to anything and was just there. Naturally, this caused concern. Where did it come from? What was that? After Michael saw this, his thoughts changed. If his little girl was born with cancer, how could this happen? Suzanne was an unusually healthy person who did everything right during her pregnancy. From the moment she found out she was pregnant, she tried to do everything as best as possible, gave up coffee, didn't drink a drop of alcohol, ate healthy, took all the necessary vitamins, and rested. When Michael asked about cancer, doctors simply brushed him off. They told him there was no point in worrying so much just yet. They had no idea what it was. They needed to conduct additional examinations. They had tried to avoid color scanning, but now it seemed like their only option. Before surgery, they prepared everything they needed and immediately got to work. They had to put ink on the organs to see what they were dealing with. She was simply too small for the scan alone to work as accurately as it should. So they slowly injected the ink into the patient's abdomen and looked closely at the screen to see what was wrong. Then suddenly, the doctor stopped the examination and abruptly left. This, of course, was extremely unexpected for Michael. What did the doctor see? Why did he react this way? The longer Michael thought about it, the worse the prognosis seemed. He was nervous and afraid of what might happen, but no one could prepare him for what he was about to find out. When the doctors returned to the room, they looked scared and slightly confused. However, when they began to explain what they were dealing with, everything fell into place. They explained that the child was experiencing something unlike anything they had ever seen before. That's how rare this is. Michael could hardly believe his ears. As the doctor explained, it all started to seem more and more crazy. "It looks like your daughter has a fetus in her belly. The fetus is in her belly." What kind of sci-fi dream did Michael find himself in? He kept waiting for awakening, but this never happened. How could this happen? Confused, he began asking questions. The doctors gave a simple, albeit discouraging answer. This happens extremely rarely, but it does happen when one of the twins can consume or absorb the other twin. In this case, the fetus may end up in the abdominal cavity of another. This was even more terrible. The idea of Suzanne carrying twins only for one to consume the other was very strange and disturbing. Fortunately, the doctors had a cure. They explained that if they were careful enough, they could remove the fetus from the baby's abdominal cavity, and she would hardly know about it. However, they needed to proceed with surgery as soon as possible to prevent further damage. Since Suzanne was anxious, Michael simply told them to go ahead and do what was necessary. He knew all his wife wanted was for their healthy child to be with them, so the baby girl underwent life-changing surgery. Doctors carefully removed unnecessary tissue. At this stage of fetal development, he was only 2 inches tall. It was scary considering how small the child was. However, they were happy when the fruit was extracted. Now this would mean that she could eat better and even lead a completely carefree life. Michael and Suzanne were extremely grateful that their little girl was getting better. But the thought of having twins seemed like a dream, and the realization that they might be born hurt a little. But they knew that God had a plan for everyone. Their little girl was included in the list of the rarest patients to date. She was truly one of a kind, and thanks to exceptional medical care, she continued to live her normal life. Dear viewers, if you liked this video, then like and subscribe to our channel. Goodbye.